Hi again, it's Lisa Moody. Today we're going to talk to you about treatment options for androgenic alopecia. There's a couple of different treatment options that are newer on the market, but there are some other ones that are tried and true. The first one, let's say that I get a biopsy back and it does prove that to the patient that they've got androgenic alopecia, then there's a couple of different options that we can do. So the first one would be to say that there's a program called HLCC, which is Hair Loss Control Clinic. And what that is it's a program that has a shampoo and a vitamin in it, shampoo with a vitamin and a conditioner with a vitamin that has all the benefits of blocking DHT on the surface of the skin. That program also has a vitamin in it, which that vitamin has all the DHT blockers in it that are herbal, but it also has all your vitamins that you need for your hair follicles to kind of rejuvenate. There's another thing in that program, which is a laser. It's a low-level light laser, and what that means is it's a red light, and you sit underneath it, and it's not a painful laser. You sit underneath it for 30 minutes. And so what that does is it increases blood flow to the scalp, and it also causes angiogenesis, which just means that it makes your blood vessels grow to your hair follicles so that you can get nutrients to them so that they can repair themselves and then grow again. Let's see. The other thing in that program is called Restem Plus, and what that is, that's a product that contains minoxidil. It's a minoxidil 5%, kind of like Rogaine over the counter. And so, but the good thing about the one that's part of that HLCC system is that it doesn't have all the alcohol in it that the Rogaine over the counter does. So it's kind of nice in that it won't make your head itch. And so that's really a good thing. And it has all the DHT blockers in it too. So if you're gonna just go with the HLCC program, which sometimes people do, then that's the laser, usually once or twice, up to probably 4 to 8 times a month if you wanted to do that. They would do the minoxidil pretty much every day. The vitamin is twice a day, and then the shampoo and conditioner. All of those products, when you purchase them, they last for 3 months. And so that's kind of about the time that you need to take photos again anyway to do your before and afters. The second option that we have for treatment is called finasteride. Finasteride is the generic term for Propecia. And Propecia is a topical medication. It used to be by, or it still is by, oral medication, and guys can take that, but females really don't need to be taking finasteride. So we use it in from a compounding pharmacy, and they make it for us, and it's a dropper. So you drop 1 ml of fluid of this finasteride on your scalp, morning or night, 1 time a day. And so that will block the DHT that I told you about in a previous video so that your hair follicles can rejuvenate and start growing again. That by itself works pretty good, but if you wanted to alternate it with the minoxidil, you could do that too. And the third thing that we have to option is PRP. And what PRP stands for is platelet-rich plasma. So what we do, that's the vampire hair restoration program. And so what we do with there is we draw your blood, we spin it down into a FDA approved centrifuge. It separates out your red blood cells and white blood cells from your platelet-rich plasma. Super cool, just because you're using your own blood products to get the best growth factors out of it that are your own, and you inject them back into the scalp. It's a process. It takes about, just a couple of minutes to draw your blood. Then we spin it down, which takes about 15, and it takes me about 5 or 10 minutes to inject it back into the scalp. Depends on which centrifuge that you use and which test tubes that you use, whether that process is painful or not. Some of the ones that are used for orthopedics are very, very painful because they're buffered a different way. But the ones that we have now are really not painful. You can either use a machine called a Zimmer, which is really like air conditioner on the skin that really helps with pain control, or you can use a little vibration device to help with pain control. But that's it's not bad, but you're using your own growth factors, and those growth factors haven't been told what to do yet. So let's say you inject them into your knee, they'll go in there and repair your knee. If you inject them into your scalp, they'll repair the hair follicles, and then those hair follicles will repair themselves, and then they'll start to grow hair again. Usually we'll recommend 1 treatment a month for 4 months, and then every 6 months to a year after that. 1 to 2 treatments, people will stop losing their hair, and 3 to 4 treatments, they'll start growing hair. The day that you get the procedure done, you have like little knots on your scalp where I've injected it. But then that night when you lay your head down on the pillow, it's a little tender. It's not bad. But the next day it'll be back to normal. And then you really won't know that you had anything done the next day or the next day. So it's really not a bad procedure. Out of all the processes that we have, I think a combination of all of them is the best for androgenic hair loss. But, you know, everybody's different. Some people can afford the PRP, some people cannot. And if that's the case, then I'll put people on the HLCC products and the finasteride first, and then have them do PRP whenever they can. Some people want to go all gang out and they want to do everything, and so we'll do the PRP, the finasteride, and the HLCC. So it's a very personalized treatment for your androgenic alopecia. You just have to tell me what you need and what you can do, and we'll work with it. So hopefully that's kind of explained what PRP is. Super cold treatment, works really well for androgenic hair loss. And then there'll be other videos to follow on vampire microneedling and vampire facelift and vampire facials. So, okay, Merry Christmas from Texas. We'll see you soon. Bye.